Hello, I'm Paul Laney, the retired sheriff from Cass County, North Dakota, and the current vice president of national sales for Turnkey Corrections in River Falls, Wisconsin.
And I'm Lauren Matthews, and I'm the current social media and content specialist here at Turnkey.
And you are listening to Jail Talk. Lauren, it's good to see you again. I feel
good
like
to see you too.
My sidekick, my partner in crime. We haven't crossed paths in a while.
I know, it's been a while. I started to forget what you looked like.
I know. Well, I remind you pretty quick.
That's right, yeah.
It's like, he's here.
There
he
is.
He's back. So how was your holiday?
It was good. It went fast, a little unconventional, but hey, it was 2020, so
exactly.
what was normal?
That sums up so much. I saw one of those memes on Facebook, and I kind of laughed how 2020 is going to start summing up everything kind of bad. Man, I just had a 2020 kind of day, and I'm like, oh yeah, I'm already kind of halfway saying that.
Right.
So, well, I tell you what, we are very excited about our guest today.
That's right.
I met our guest today during my time as the incident commander for the National Sheriff's Association's coordination cell for the pandemic. And back in March, Turnkey Corrections borrowed me back out to NSA. And I spent 2 months running the show for NSA and working with the coordination cell and kind of coordinating the response. And I had the absolute privilege to get to meet Dr. Rachel Silva with the Hennepin County. She's the medical director for the Hennepin County Sheriff's Office in Minneapolis, Minnesota. And we got to chew a lot of new dirt together, didn't we?
Yes.
And what was interesting, and especially in the times of COVID, we never met face-to-face till today. We talked to each other dozens of times and spent much time on the phone as we were trying to solve issues for the nation's sheriffs and communicating to the executive directors. And you were just a godsend. So, Dr. Silva, welcome to Jail Talk.
Thank you.
And
Thanks
it's
for
really
having me.
Really cool to meet you in person. So.
Great. Yes. Nice to meet you as well.
So, I think at this point, normally we do a lot of the bio kind of stuff, but I think I'm just going to hand it off to you. And
Yeah, well, before we dive in, because we have lots to talk about, but before we do that, can you tell us just a little bit about yourself, your background, and how you came to even be a doctor in the corrections industry?
Sure. So my name's Dr. Rachel Silva. I am a general internist. So what that means is I think of myself as sort of an adult doctor, Generally speaking, I practice in Minneapolis for Hennepin Healthcare, and we contract with the Hennepin County Sheriff's Office. And so I am very fortunate to have a really broad career and broad practice that way. I am originally from Iowa, grew up in Des Moines area, did my schooling mostly in Iowa, went to medical school there at the University of Iowa, and then actually did my residency training down in New Orleans in Louisiana, and found my way back up to the Midwest to Minneapolis to work in Hennepin County in Minneapolis after finishing training. And I've been in my working through Hennepin Healthcare for about almost 7 years now. And I kind of fell into the work with corrections, to be honest. A colleague of mine was going on maternity leave and sort of was looking for people to cover. And I sort of thought, that would be interesting. I kind of had taken care of some people throughout my training who had been in custody and sort of kind of started to understand kind of some of the challenges they faced with healthcare, and just thought, this is something I want to try. And I've really enjoyed it so far, and have been in my role as medical director about 4 years now at the jail. And that role has kind of ebbed and flowed over the last few years and then exploded with the pandemic.
In the last year. Can you imagine? I imagine when you were going to school at the University of Iowa and you going to medical school, did you ever think that you were going to be a doctor in the corrections world, going to jail every day and dealing with the things that you have to deal with?
Definitely not. I always kind of was really interested in community health, kind of public health type concepts, and wanted to kind of have a really sort of unique career. But I feel like this is something that sort of fell into my lap, and I've enjoyed kind of getting to ride along the way so far with it.
So you kind of said it when you talked about how the last year exploded in. So I'm just going to kind of dive right in with the questions, because a big our topic today is going to be COVID in the jails and the COVID response, and so much of it has impacted the nation's sheriffs and the jails within and nobody saw this coming. Nobody knew that this was going to be happening. How did life change for you? I mean, in your environment, for your staff, for the jail staff.
Sure.
How did you and your team deal with something that weeks prior nobody even knew about?
Yeah. No, I distinctly remember actually in January of 2020, kind of writing a policy around this COVID-19 or novel coronavirus, and kind of writing these questions of like, have you been to Wuhan, China? And thinking, this is like all we're going to have to do with this. And then sort of, I think around the country, everything started popping up and thinking like, oh, this is really real. This could really be happening. And then I distinctly remember, mid-March is when we sort of had the declaration of community spread in Minnesota. And when that happened, just sort of thinking like, pit in my stomach thinking, oh, this has happened. And so, I think there was this opportunity in a way to sort of step back and say, like, what are all the things that we need to think about, and then work together with the sheriff's office. And, we met regularly to sort of think about staff and inmates and sort of how do we keep everyone safe? What are we going to do in terms of testing? How do we get access to testing? Who are we going to test? How are we going to quarantine people? How do we have to change this procedure and that procedure? And I think probably like everyone in the country for most things in their lives, but, from a day-to-day process and in terms of operating a jail's really complicated when it comes to how it works, who moves where, when, and how close people are. And when you're thinking about a disease that's spread through air droplets, and these tiny, tiny particles in the air, it gets really, really complicated. And so it really, for me, I've learned way more about jail operations than I ever knew, to be honest, because there'd be this question about, what about this area? And I was like, I didn't even know that existed, to be honest. And so I think that's really allowed for an opportunity to work more collaboratively with our sheriff's office as well, and not sort of just being seen as medical, but to really say, like, this is a medical issue, a public health issue. How are we going to work together to keep everyone who's in this facility day in and day out safe?
Well, I remember just kind of having that same feeling when I'm VP of National Sales. I've left the sheriff's world. I've been, retired at that point for, a year and probably 3-4 months. I'm completely in my role here. And, the COVID thing was just starting to kind of come on the radar scope. My daughters had gone to Florida for spring break. It was kind of at that beginning, and I'm starting to tune into this thing, and I'm calling them down there, maybe you guys should maybe start thinking about coming home at some point here. And they're like, yeah, this Friday is when we're scheduled to come back. And you just start like, what is this thing and what's happening here? And, my sheriff brisk, manager had started to come on thinking, is this thing really what they're kind of making it sound out to be? And then I'll never forget, I went home on March 12th. I went back to where I live in northern Minnesota, and I was sitting outside the grocery store. I got a call from Jonathan Thompson, the executive director of National Sheriff's Association, saying, hey, need a minute of your time. And I didn't have any idea. I thought he was, I've known him for years, and when I was heavily involved in NSA, and next thing I know, he's asking, will you come run this coordination cell? And I'm thinking, wow, boy, this thing is real, and to do that. And he, basically he says, I want permission to contact your company and ask if they'll borrow you to us for a couple months. And, I'll say this about our owner, Todd. He's like, hey, we got the guy you need, he's yours. Let's go beat this thing. And little did I know then where it was going to go and how the environments were going to change. And I remember sitting on those phone calls with you, and I mean, we had 1,000 questions. And of course, when you talk to the doc, you expect them to have an answer. Well, come on, solve this thing for us. Come on, Doc. Yeah. What do we do?
Yeah, I think that's, for me, I mean, that it's been incredibly humbling. You never want too much humility, but just in terms of, as a doctor, you go to school forever. People really expect you to know the answer, and they want the answer. And I think it's hard to sometimes feel like an authority on these things, because I'll tell you one thing today and in a week I'm going to tell you something else, and it's not because I'm wrong, it's just because we know more. And so I think that's been really a challenging part of navigating all of this too, is coming up with guidelines and sort of saying, we'll do this now, let's kind of reassess in a couple weeks as we learn more, as we see how it works. Within healthcare and within most industries, there's opportunities for kind of quality improvement and continue to kind of look at procedures. We do that anyway, but with this, it's just been constant of saying, like, today we're testing these people, tomorrow we're testing these people, and then in 4 weeks we'll use this kind and then of testing, and this we're going to do something else. And then we did experience an outbreak within our jail, and I know many jails have had that experience as well. And after that, or sort of as it was going on, it also gave us this sort of another chance to say, what else do we have to think about? Because what was happening was working and now it's not. And sort of how do we keep trying to get through this, knowing that people are tired, knowing that people are ready to move on, and knowing that this is a disease that we know, for many, many people will give them very mild symptoms and they'll be just fine. But for those folks that we can't decide who they are and we have no idea who they're going to be, they won't be with us any longer. And it's a very sad way to pass. Right. And so that's just where it's this constant sort of how much work is everyone willing to do to save those folks?
Absolutely. Well, and it was such a fearful time because the unknown, especially for people, I think, like us, you as a medical doctor, me, being in the sheriff's role, you're used to being in control. You are used to having the answers and being in control. And all of a sudden we weren't, and things were trial and error. I always used to say, I'd go before the county commission every year for my budget. Every year I asked for a crystal ball. Every year, and they just couldn't afford one for me. And how about you? Do you guys get crystal balls in the medical world?
I wish. It'd be great. People always ask how long they have to live in.
And so, and my point with that being is we don't. And even you're some of the best experts in the world. A lot of things, when it's something like this, you just gotta do it. You gotta come together, and you gotta put any biases aside. You gotta put everything, and just what's for the good of all, and what's for the good of our facilities. What can we learn from each other? And that was our goal with the coordination cell. And it was really amazing to be part of something like that, and to be able to sit down and have access to people like you and say, okay, well, at least we're given our best information that we can give based on knowledgeable people that understand what they're talking about, and next week, who knows? But we're going to do the best that we can do, and it's been, and now we're where we're at now, so it's been good.
Well, we've been in this pandemic, unfortunately, for seems like quite a while, and so what have you seen from the beginning of the pandemic to where we're all at today, and what's happening in the jails regarding COVID?
Sure. I think as we were talking about when this first started, I think everyone was just scrambling to figure out, sort of, I feel like it was kind of this like slow moving train where you sort of saw it and thought it's off in the distance. Like I'll just kind of wait it out and see. And then all of a sudden it was like about to hit you. And so I think, it's really taken, there's just been so many pieces. I think initially it was just as a doctor, like understanding a new disease. I mean, there's this piece of I need to be able to understand what could happen to people to give proper guidance, to be able to know what I'm seeing. If someone's sick in front of me, is this COVID? I mean, part of what's been so challenging is like one day it was these symptoms and then all of a sudden it's all these other ones too. Right. And sort of being able to say, this is COVID, this isn't, it's just not that easy. So I think that's a piece of it. I think there's the piece of just infrastructure, the structure piece of how do you take a jail that this congregate environment with all these people moving in and out every day, and how do you make it so that you can try to socially distance as much as is feasible, get people to wear masks if they'll do it, all these pieces that we know are kind of the keys to reducing spread for this really contagious disease. How do you sort of change all of these procedures to make this feasible? And I think it's taken not just collaboration sort of with medical sheriff's offices, but I know within our county, discussion with community corrections and the prison system and sort of all these other pieces to say, like, in many ways, this is all one big entity, and we have to figure out how do we work together to do things not only sort of from a medical public health side, but also like, can we influence the counts? Can we influence sort of who needs to be in the facility? All of these kinds of things that I think before COVID, it was just business as usual. And this is sort of just upended business as usual.
Do you think it's going to change how we look at things in the future with correctional environment? You hear a lot, over the past couple of years, we've talked alternatives to corrections, alternatives to incarceration. And, we talk about how, in the pandemic, how in the future, how businesses are going to look at their people working on the facility and people working from home and how that's how going to do that. Do you see that having an impact on what happens inside of a jail? And and how to prevent this in the future.
Sure. I mean, I think certainly in terms of counts and sort of population size, it is important to think about just generally, who belongs in the facility, who doesn't. From a public safety side, that's always a concern. And then certainly from a public health side, too, we know with contagious diseases like this, especially ones transmitted in the air, influenza, COVID, that the more people there are in a space, the more likely there is for diseases to spread. So I think from that perspective, it's changed things. I think from my perspective, I feel like it's given us an opportunity to work more collaboratively with the sheriff's office. We always have, but I think there's just more conversations to be had.
Those conversations had to happen.
Yeah, they had to happen then. They continue to happen because things change. People hear about stuff. This jail's doing this. Can we do this? I'd never gotten as many calls from admin and the sheriff to be like, what about this, what about that, what about antibody testing, what about this? And I think just being willing to be a resource and understand that piece and sort of where the medical pieces fit in all of this. And then I think also in terms of where do we go next, I think there is sort of, from what I've read and heard, that there will be other pandemics, or there could be other pandemics. So I think this idea of really having a strategy to have sort of this emergency management plan and be able to say, yep, nope, we all have to put masks on now again, or like this really is about getting these operations to where we can just shift gears, at a moment's notice to kind of get everyone back in gear.
Well, what I hope really happens when this is all said and done, and the politics are out of everything. I mean, what a horrible year to have a pandemic too, on top of what was happening. It doesn't matter what side of the aisle you're on. I'm not even talking, but it just was a horrible time to have it happen because it got so politicized one way or the other. You have those that firmly believe in masks and those that believe that don't believe in the masking thing. And I'm not here to pick a side on either thing. But I think what I do hope comes out of this is that as a country and especially as a profession, that we have that ability to look back at this later on and start making educated decisions on what worked and what didn't. Let's take the politics out of it. Whether you think this governor did a great thing and this governor did a bad thing, whether this city did a great thing, this city did a wrong thing. What's the right thing to do for our people, and what's the right thing? So many will say, well, they're just inmates. Well, as a sheriff who took an oath of office to protect those inmates, that's not the philosophy we can have. Well, they're just inmates in jail. They just need to be in there, and whatever happens, happens. Well, it's easy for you to say sitting in your chair at home with whatever your opinion is. When you are responsible for the lives of these people, it's a whole different philosophy. And whether people agree with why they're in jail, whether they're not, they're our responsibility once they're in there. They're our responsibility to care for them. They're our responsibility to make sure they're safe. And that's the thing I think we really need to assess across this country is if this happens again, not only for our jails, but for our communities. And hopefully that's something that can come out of this. And you're going to have a lot to write about, Doc, here as we go forward, and you were at the tip of the spear of this thing from both a national level and now from your daily job. So, you hate that, you don't want to say good comes out of this, but hopefully knowledge comes out of this.
Yeah, and I think one point, too, is that I think in terms of us, the conversations like I meet every week with our state health departments and often county health departments on that, too. And I think one thing that's sort of come to the fore is just this idea that, like, jails really are at this epicenter of public health in many ways. We all know that there's sort of this revolving door of jail. And for some people, that means there's high recidivism rates and, that there's sort of that side of things. But from a public health standpoint, it's just this in and out churn. And when you're talking about a virus that spreads in these confined spaces, you have the potential to really magnify what happens in communities. And so I think there's kind of this responsibility in many ways, speaking for myself as a public health person, to do everything we can in the facility, both to keep the people in the facility safe, the inmates and staff, and then also to kind of think about how that impacts their families, the community, that ripple effect. And so it's really... I think it's easy just to go about your day and be frustrated you have to wear masks or that you can't eat with your friends or whatever. I get it. We all have had to, I think, make incredible sacrifices in this last year to sort of change everything about our daily lives. But at the same time, I think if we can sort of step back and think about sort of the opportunity in a way to really evaluate all the systems we're a part of and think about sort of what else can we do or what other opportunities are there within jails to really make a difference for the community. I think it has presented in some ways that too.
Well, let's on that note, I think that leads me perfectly into a question I wanted to ask you, and it's a hot topic: vaccinations. Both from the standpoint of the sheriffs and chiefs and law enforcement leaders having their people vaccinated that are out there every day dealing with whether it's in the jail or whether it's dealing with people in the street and then bringing them into the jail, and then both from the point of vaccinating the inmates, because there's a lot of topics on that. So. Yeah, what are your thoughts as a medical professional who is responsible for the medical health of a facility?
Sure. I am very pro-vaccine. I will just put that out there from the get-go. I think vaccines work. We know they work. There is incredible science that's gone into vaccines throughout history, and then particularly with this latest vaccine, I know it came fast. I know it came, in sort of record speed with this Operation Warp Speed and everything. But there was good science that went into it. This was technology that was in the works. It wasn't just sort of came out of poof, out of thin air. And there in order for any approval to happen, there are procedures in place through the FDA and through the government that really make sure that these things are safe. I think I actually listened to some of the ACIP meetings. It's the American Committee for Immunization and Prevention, and they work with the CDC to make these recommendations around who should get the vaccine when and whatnot. And if this wasn't a safe vaccine, it would be pretty silly for them to say, let's just give it to all the care workers. Let's just kill all the doctors off.
And for me, I sat back and listened to a lot of this. I have a daughter that's in the medical profession, and I so you're concerned, and obviously being in coming from the law enforcement world. But at that point, do you think that's one thing that was my comfort factor? I can't speak for anybody else, and I'm not trying to tell anybody else what to think. But what I will say for me, as I was like, these doctors and nurses are lining up to get this thing. Do you think they would? They have the most knowledge of anybody in this world about what this stuff is. Do you think they'd be putting it into their bodies if they were worried? And I believe you probably have had that vaccine, I think you said.
Yep.
And so, I mean, would you have put that into your body if you feared for your life?
Right. No.
That tells me something.
Yeah.
No offense, that was comforting for me
right.
that you did that.
And I think, when we have to think about sort of what vaccines are for and what they do. So this term herd immunity has gotten thrown out there. It got a little politicized for a while, I feel like, and sort of, effectively what it means is you need enough people in society to have been exposed to a disease to where it can't spread. And so that's why we have vaccines, because we know that there's these diseases that they're worse than the vaccine. We know that vaccines have some side effects. Often they're quite mild. Some people don't experience it at all. And we know that for the most part, if enough people get them, people are safe from these diseases that, while they may not kill millions of people, they lead to kids getting sick, missing school, parents being sick. They sort of have this bigger ripple effect on society. And we are very part of why the health of everyone right now in this country in particular is where it's at is because of vaccines. We don't die of things like diphtheria and, measles on a mass scale. There's things I think we take for granted because of that. And so I think it's really important that we think about that. And then going back to this point about, inmates, staff, who gets the vaccine, how, to me, again, I kind of think about the jail as this contiguous unit. We, used the term congregate facility. So in many ways, although the purpose is different, a jail is not unlike a nursing home. There's people who are residents there who stay there. And then there's people in and out who are there to sort of oversee the care or, of those individuals. And so, really, unless everyone is vaccinated or has the opportunity to be vaccinated, it doesn't actually protect anyone, because at any point people could still transmit the disease back and forth. And we know that's how, when there are outbreaks in facilities like jails or nursing homes, that's how it happens. It just goes back and forth between the different groups of people. And so to me, it's really important that everyone gets it. I think obviously there may be political concerns about saying that one way or another, but from a purely public health standpoint, it doesn't make sense to pick a group. And I think I would say, sheriffs out there, that if you want to protect your staff, protect your inmates. And if you want to protect your inmates, protect your staff.
Good advice. Good advice. It's kind of a whole, not a half.
Yep.
So, what's one of your biggest frustrations in providing medical services in a correctional environment?
Sure. I think, with the pandemic, I think one of the biggest things we've seen is just this is expensive. It's expensive to sort of change the way we provide care. It's expensive to do the level of testing we need to do to keep people safe and identify COVID. And I think one thing that is frustrating around COVID and then just generally is that it always comes down to the budget. It's sort of this back and forth about, do we do this test now or do we wait a little bit because maybe they'll get out of custody or those kinds of things. And I think one thing that would make a really big difference is Medicaid. So I know that the National Sheriff's Office Association has talked about this before, and as a doctor who
and one of our prior guests, Dave Mahoney, the current national president, was very adamant on this topic.
Yeah, and I think with that, as I'm a doctor in the jail most of the time these days because of COVID, but I also am a primary care doctor, so I see people in the community in clinics, many of whom are on Medicaid, and given sort of this role where I can kind of see both sides of how people get treated in the different care, I think we provide good care in our jail, but I think at the same time, we know that because people get cut off of their insurance or because there's things that they can get one place and not the other, we know that leads to health disparities. We know that it's not really equitable, that people aren't getting the same thing, and that it leads to different communities or different groups having different health outcomes. And so if we can, and frankly, it's just a bottom line thing too. I don't want to have to be the person who says to the sheriff's office, we need a nurse, we know you need deputies. That's not a fair conversation to have. And so I think in the end, it would really benefit everyone involved with the care of, folks who are in detention to have this ability to use this, source that they otherwise would be using for their healthcare to be able to provide, better access to care.
Well, and ultimately it comes back on the taxpayer of that county anyway then, because they come in with their Medicare benefits and then they go away instantly. Who's on the hook? The county taxpayers for that. So, I tell you, this kind of just gave me an idea, Lauren, just as you go, I'm thinking, oh my God, we could talk for, a half hour, an hour on this. We do a whole show on this topic alone. Would you be willing to come back another day and actually talk about that topic in depth? Because I think for our listeners, for our sheriffs, for our jail administrators, this is such a hot topic. It's such a hot topic for the taxpayers, and you're the expert. We'd love to have you back. Would you be willing to do that?
Sure, I'd be happy to.
Excellent. I think that's great.
Well, we'll look forward to that. But until then, we're kind of got to wrap up this show. What is your kind of final advice you have for the sheriffs and jail administrators regarding the next few months with COVID and just continuing on with all this?
Sure. I know we want this to all end. I know it'd be nice to just go back to normal. And I think we will get there. I think we'll get there, and it may even be later this year. But I think for now, if we can just hold on tight a little bit, just kind of dig in, remember that 400,000 people have died of this disease. This is not a joke. And that if we wear our masks, if we keep apart a little bit more, if we get the vaccine when it's available to us, we'll all get through this. And I think hopefully we can be more unified and stronger, as we kind of think about how we can move forward after this.
Well, I tell you, great advice, and I can't thank you enough for coming on today. As we were talking about different things, our goal with this show is that sheriffs and jail administrators can come off the podcast or the watchcast and go, I'm doing this, or I'm going to do it, and you've helped us do that today, and that's our mission of the show is to provide back and give back to our sheriffs, and you've been a huge asset in that, and your knowledge. Like I said, we've just touched the tip of your knowledge of this. So, thank you for joining us today. It's been an absolute privilege to have you here, and I really do look forward to having you back on again, and we can dive into some deeper topics as well.
Sure.
So, thank you.
Yeah, no problem. Thanks for having me.
If anybody has any questions or comments, or maybe you want to be featured on the show, email us at jailtalk@turnkeycorrections.com. You can also follow us on Twitter at JailTalk Podcast, and make sure you like, share, and subscribe on our YouTube channel to watch all of our past podcasts. And if you want to listen, you can listen on jailtalk.podbean.com.
All right. Well, I'm Paul Laney.
And I'm Lauren Matthews.
You've been listening to Jail Talk, and we'll see you next time.